Stop Now, a social experiment enterprise. Stop, listen, share. Everyone can make a difference. We are on a mission. Everyone should do something greater in their lifetime. Change the future. Be a proud member. Join us to support, volunteer, and donate.
Hello, welcome to Stop Now. I'm JK and I'm joined by my co host Shiva. Hi, Shiva.
Hi JK, thank you for joining now.
Let's welcome our special guest on today's episode. Aidee, how do I say your name? Uh, Pardon me, you can introduce yourself and tell to our audience, viewers, about yourself, and then we can go from there.
Yes, sure. Thank you, JK, and thank you, Shiva, for this invitation and the Stop Now team for this initiative. My name is Aidee Granados. I am the founder and CEO of Rosa Rojo, a nonprofit educating Hispanic women on wellness and cancer prevention. Thank you so much, and it's my pleasure to be here with you sharing. Just stop, listen, and share. That's the three verbs that you were mentioning, and I'm so happy to be here doing the three things this morning. Stop, listen, and share.
Wonderful. So jumping on straight to the question, so what is the mission of your organization?
Sure. Well, Rosa Rojo is a nonprofit. It's a 501c3 since 2016. We have been working on a mission to educate Hispanic women on wellness and cancer prevention by educating them on the topics of nutrition, physical activity, emotional health, and positive thinking. And part of our social innovation of doing that is that we are using Spanish as the main, as our primary language, and also culturally relevant content in all of our programs. Spanish and using culturally relevant content. How we have been doing this since 2016. We have two signature programs. The first one is called the Rojo Way, in Spanish, El Camino Rojo, which is a 20-hour-long community wellness program centered on nutrition, physical activity, emotional health, and positive thinking. And we use in-person and virtual training, one-on-one mentorship, and support groups. And then we have Supervive, or Supervive in English. That's how we call our second signature program. And this is a virtual segment based on a weekly podcast and a YouTube channel. So for us, Supervive is the way to give our participants a continuing wellness education in order to prevent cancer and other chronic diseases. Why we are doing this? Why cancer prevention? Well, according to American Cancer Society, cancer is the leading cause of death among Hispanics in this country. And it is not a secret that, Latinos in Texas, in less than 2 years, we are going to be not only a minority anymore, but a majority group. So the problem and the need is huge. Another statistic from American Cancer Society is that 1 in 3 Latinas, Hispanic women, will have cancer at some point during our lifetime. So I was part of that statistics. I'm a breast cancer survivor. I have a daughter. She's part of that statistic. And I know, and we know in Rosa Rojo, that we need to do something to change that. The good news also, talking about statistics, according to American Cancer Society, is that more than 42% of all cancer cases have roots in an unhealthy lifestyle. And according to CDC, it's more than 55% of all cancer cases have roots in an unhealthy lifestyle. So if we change the way we are eating and feeling and thinking and moving, which is part of the healthy lifestyle, we can prevent cancer and other chronic diseases. So that's why Rosa Rojo is on a mission to change the way that we are living here. The lifestyle that we are having in order to have a healthier and more resilient Hispanic community.
That's a great one. Thank you, Aida. And we are joined by our co-host Melissa as well. Melissa, right on time. So we have.
Nice to talk to you.
Hi, Melissa. Nice to meet you.
Nice to meet you too.
So we just focus on different segment. As we mentioned about different projects and campaigns we run, and mostly with mental health and other issues which we can touch on later on. Melissa will be the right person to ask.
How can we change our lifestyle?
Yes. We have a community wellness program, or a model, that's what we call. So the lifestyle could be integrated by many things, right? As I was just sharing, the way that we are eating. So that's why we teach and educate our participants, Hispanic women, on nutrition, but also the way that we are thinking and feeling. So that's why another two main pillars in our model is talking about positive thinking based on the positive psychology, and also emotional health, recognizing and naming emotions, just to try to not to use just negative thoughts, but just using positive thoughts, as a way of learning how to do it on a daily basis, and so on. And of course, physical activity, because I can be just, eating super real food, or thinking positive in the face of adversity, but maybe I am not moving my body. So I just need that, I would say, balance or combination of these pillars. So our model is on a mission just to educate on nutrition, physical activity, emotional health, positive thinking, in order to start those changes, Shiva. At the end of the program, at the end of the Rojo Way, we are building with the participants an action plan, because we know that it's not enough just to receive information and to know how to read a label in a food label that I can just find in the supermarket, or how to measure my consumption of sugar, or having positive thinking. That's not enough. That's information. But then we have this part of the Rojo Way, which is just to make and to build an action plan. So we together, we are just doing specific or smart goals, right? To start with, because if I haven't been, eating, healthy food, I cannot start, like 100% real to starting tomorrow. So we have to go from less and little by little, just to be closer to that big goal. So we have this action plan with the 4 pillars, with the SMART goals in nutrition, physical activity, emotional health, positive thinking. And we have something that we call ambassadors in Rosa Rojo. An ambassador is a participant who already finished the program, graduated from the Rojo Way. They receive a trainer, and they are ready to accompany, just to walk with another participant, and just help them with the action plan, with the specific resources. And after the 4 mentorship sessions, they are ready to graduate. So we have the workshops first, and then the mentoring sessions. They complete the 20 hours, and they are ready to graduate. But just answering more deep your question, with the Rojo Way, with the 20 hours, that we can say the 6 months that they are going to invest in the program, that's not enough. So we need to offer them a way to keep doing this healthy lifestyle that they are embracing. So that's why our podcast and YouTube channel and the support groups that we offer on a monthly basis, that's part of what we are offering in order to keep supporting our participants on this quest for a healthier lifestyle. So this is for everybody. What Rosa Rojo is doing just to accommodate this model for a minority group living with a lot of social determinants of health, struggling with a lot of social determinants of health, with no insurance, with no English, so most of them are undocumented immigrants that we are working with. So just giving them a solution in Spanish using culturally relevant content, that has been effective, and it's also the right thing to do for them.
Oh, that's great. I was actually going to ask that, like, if they're finished the program, what would they do to be able to keep going? So that's great that you guys have, a community that everybody can stay in touch with, after they're finished with the program. So what kind of impact would you say that this is making on the community? If you've been seeing like a great change and people are starting to, use those four pillars more often than not?
Yes. And you know what? I mean, we are we call a data-driven organization. So we measure all the time. And I will be more than happy to share with you the annual report, so you can maybe share those in the comments that you will have on your social media platforms. We measure at the beginning, talking about the Rojo Way, at the beginning of the Rojo Way, just to see how the participants are doing with healthy habits, right? In terms of the four main pillars. And then we have another evaluation after the workshops, just to see how they are changing or starting to change. And just right before graduation, we have a third evaluation from University of Pennsylvania, which is called the PERMA test. It's a test that is evaluating well-being. So the PERMA test also, we apply the PERMA test at the beginning and then at the end. So we can compare. And some of the impact that I can just share with you from the last annual report, today we know that 89% of our participants, they have improved resilience and well-being. This is from the PERMA test from University of Pennsylvania. 99% of our participants, they have maintained or improved their healthy choices in food. 99%, they report that. 96%, they have reported that they maintain or improve their emotional health. And I have to say that this past year, we saw a decrease in the emotional health component because of all the pandemic and COVID situation that we were living. Another impact that I would like to share is 98% of our participants, they reported that they have maintained or improved ability to learn optimism, and 99% they have maintained or improved their physical activity. So that's pretty much like the impact or the outcomes that we shared in our annual report and with the foundations, our donors and participants. We are about, this year, 2021, we are about to measure the impact of the participants that we had at the beginning of Rosa Rojo in 2016, 2017, because this is just the impact of our participants last year. Mm-hmm. But this is the first year that we are now, we are going to be able to measure like in the long term, or maybe it's not that long, but what's happening with a participant that we had 5 years ago?
Right.
Where is she now? What is her family? What is she doing? How is her health? So we just did a focus group a couple of months ago with, great results. I have to say that I really like what I saw, but the real evaluation is going to be at the end of this 2021. And we are going to be more than happy to share that in our next annual report.
Oh, that's exciting. I can't wait to hear about it, because you look so happy to hear about the results, and it's making me even more excited for you. So
we are exciting, and we are confident that the program has been effective. Of course, we have been learning, and This pandemic year has been a great challenge for us, because we used to do 100% in person, our program. Yeah. And right now, since May 2020, we changed everything via Zoom. But even via Zoom, we have been just, keeping our work in the community with the community partners that we work with. And it has been effective. We definitely miss that in-person interaction.
Right.
The program is effective, and we are just giving the tools, to be there with our participants.
No, that's wonderful that you guys were able to keep going during COVID. I know so many people lost so much and, they couldn't keep going with certain businesses. So that's amazing that you were, able to navigate through that. And Zoom has been such a good friend to many throughout this time.
I can't imagine our life without Zoom right now.
Right? I couldn't either. Oh my gosh, in so many different ways. So you said that there has been a decline. You said on the emotional side, with everything that's been going on, of course. Was there any physical decline at all? I know some people, they couldn't go to the gyms or anything like that. And I mean, you could take walks or exercise in your house, but, some people didn't want to. So was that a decline that you saw as well? Or even with healthy eating, we're stuck in the house. I ate a lot of ice cream and a lot of chips. Oh my goodness, during this pandemic.
I know, we understand that. And it has not been easy. But we were committed at the beginning of the pandemic, maybe June, July, thanks to Communities Foundation of Texas, that they helped us a lot with some resources. And we were creating something that we called Surviving Guides, like a document that our participants can download from our website. It's like a workshop, but in paper, right? I mean, like a guide. And we decided to do like one guide per pillar, like one in nutrition, physical activity, emotional health, and positive thinking, but during COVID-19 times, right? During the pandemic. So we were talking about how difficult it was to have, the face mask and not to see, another person if he or she is smiling or not smiling, or the need to hug one another. Many of our participants, they were receiving food, for example, from food banks or donations, churches, community clinics. So we that specific guide, we were talking about the food that they were receiving, because even though it was a challenging year, we know that. I mean, it was possible to have a healthier lifestyle. I mean, in our I would say, possibilities. So just having the support groups via Zoom every single month, we had it. Every single Monday during the pandemic last year, from May to November, we had a live event on Facebook, calling the community, calling experts to share a topic related with COVID-19. So yes, we saw a decreasing on the emotional health component. We understand that. We know that we lost many things, many people that we love, jobs, but even though we wanted to be just working with our participants and putting resources in their hands. I mean, food, counseling sessions. We had some support groups with personal trainers. So we were just doing exercise via Zoom because we couldn't get together in a park, for example. And right now, Melissa and Shiva, we are still doing that, but now talking about vaccination, for example. So that we need to inform our community about vaccines, and that even though when they don't have like a legal status, they can just go and have a vaccine. They don't need to pay for that. They are not gonna, have that information and use it against you. That's not gonna happen. So we need to inform. We need to educate about.
I want to ask a question about that.
Yes.
So about the future plans, and you are specialized in Latino and Hispanic communities, right? So
Yes.
Is that like outside of it, like other people can also contact your organization how does that work? And to your question on the vaccine, right? So particularly on the cancer patients, right? So how do they take it up? Like, do they get the treatments, or do they also have the opportunity to take the vaccine because they are already undergoing, like if they are going through chemotherapy or other medicines, what are the impacts?
Yeah, well, thank you, JK, for your question. And we are, I would say, like a bridge between the provider and the participant. That's very important for us to say. Rosa Rojo is not, we are not having vaccine events. We are encouraging people and educating people to go close to a hospital or community clinic or a pharmacy and ask their doctors about that, because every single person is different. We have been working hard to give them, the community, the facts about vaccines and not the myths, because there are a lot of myths like that I am not going to go because of that or because of this. We are just only sharing the information that we receive from JPH hospital in Fort Worth, or Parkland hospital in Dallas, or community clinics, or CDC. So that's the way that we are doing. So just to be specific, if someone who is listening right now have questions about vaccination, definitely you just need to go to your doctor or community clinic and ask them your specific situation. If you are allergic, you have an allergic reaction or no. If you have cancer, if you are on chemo. As of today, we know that cancer patients were in one of the priority groups in the protocols that from the CDC. So I haven't heard about any, I would say, obstacle for a cancer patient to receive a vaccine. But I insist that you need to go and talk to your doctor and see what is the best scenario for you. We know that the vaccine is effective, but that's important just to touch base with your doctors, with a professional team.
Okay, that's great, because there's so much information out there, and it's hard to try to figure out, like you said, what's truth and what's a myth. And I started laughing when you said myth, because I know for the longest time people were saying, if you get the vaccine, it's going to put a chip in your body, and the government. I thought that one was outrageous, but
and there are a lot of myths, Melissa, and we respect that. But we need to inform and educate. Definitely. And we need just to give them facts. Right. Because not only I say, well, that's not true. Yes, it is not true. But because why is not true? We have invited to our podcast, the medical team from different hospitals and community clinics to talk about that. And on social media, we share that information as well. So I think education is the key to put like an end to the pandemic. So we are supporting the efforts of the community in order to do that.
Aidee, before we, if you have more time, we can go on. But then I have a personal question. If you don't want to answer, that's fine. It's like you have a survivor of cancer, and what is your take? How was your experience like? It's kind of a death sentence. Most people think that, right? Once they get cancer, and it's like it's a traumatizing experience to overcome that, and you survived. And what are the chances of getting back, or how did you overcome those hurdles?
Wow, JK, thank you for your question. And I like to use the word journey, because it is a journey, okay? And once you have received that's my personal opinion, the diagnosis, like cancer diagnosis, is a journey that is not gonna have an end. There are a lot of people that love to see that, I finished chemo or the surgeries, or, so now I can do whatever I want. And for me, that's not true. For me, that's a commitment that you are going to make with your own life. I love my life today more than before my cancer diagnosis. I'm more conscious about the day that I'm living, the single tasking that I am practicing. I'm here with you, enjoying this moment, and then I'm going to be with my daughter later, eating lunch. So that's just a different perception that all of us, cancer survivors or no, we can have. We don't need a crisis like this big and terrible diagnosis in order to just start changing the way that we are, living and the lifestyle that we have. So that this is, having said that, this is a journey that is gonna end. I mean, I just try to keep eating real every day. I just try to do exercise, every week, maybe 3 times a week, 4 times a week, 5 times a week. It depends. I just try to, take care of my emotional health. Sometimes I have all the emotions, pleasant and unpleasant emotions. I'm a human being. I'm alive. That's great. But I am conscious about, a lot of stress, or I am just feeling these weird, emotions against blah, blah, blah. How can I just meditate, go for a walk, something like that? I'm a human being. I'm not perfect, but I am also a cancer survivor, and I want just to make conscious decisions on a daily basis in order to be closer to life and not closer to be sick, to be dead. So we don't know. Every single, again, cancer patient is different, but just I know that we are just doing our best to keep going, and I don't know. For me, sharing, it's part of my care. I don't know, system. Sharing with others, seeing we not only work with cancer patients. Rosa Rojo is a cancer prevention organization, so we are working with healthy Latinas, most of them, and we have some cancer patients. But it's amazing how they want to take care of themselves and their families and share and create a ripple effect. And for me, that's super important, and I think it's part of my medicine.
Yeah, thank you. Again, that's wonderful. I mean, just to follow up on that, how does that impact your family, right? Because it's dependent, right? Your daughter, everybody will be scared, right? Some people even think that it is on the genes and it is passed on to their family members down the line. So it scares people, like when they hear about cancer, right? And it's the most third, if I'm not wrong, third most
Yes. Well,
cause for death, right?
Yes, it's scary. I mean, there is also a movie that is called The C Word, and they the C, with quotes like, nobody wants to say cancer, or I had cancer, or I have cancer. So yes, of course, the news is going to impact the patient, but also the family or the community around your co-workers. And I think it's a great opportunity to share and to educate other people about cancer as well, because cancer can be prevented. We were just talking about that at the beginning. 42% of all cancer cases have roots in an unhealthy lifestyle, according to American Cancer Society. What are you going to do today to change your lifestyle if that could be something that is going to put you in risk? So we can do something to improve. And in terms of my family, I mean, I have only one daughter. She's 11 years old, and my husband. And when I received my cancer diagnosis, my daughter was 3 years old. And we were, I would say, like, we were eating healthy, or but my work-life balance was out of place. Definitely, I just have to say that. But also, my grandmother, my mom, my dad, even my stepmom passed away from cancer. So I don't know if maybe my genetics were negative, but I mean, there are a lot that we haven't covered yet with the genetic test. But for some reason, I got the diagnosis, right? So I think I decided not to invest my time in just asking why me, and what was the reason. And I just decided to invest my time and my my strength in the solution. So what can I do in order to prevent, and what can I do in order to try to avoid this for my daughter or my friends or my sisters or my community? So that's why Rosa Rojo is what Rosa Rojo is right now. So, but it's impacting. I mean, the day that I just decided to change the way I was eating or eating healthier, I am not going to prepare something different from my daughter and my husband, right? So we, and I'm enjoying all kind of foods. I mean, I love Mexican food. I'm from Mexico, and in my house we eat Mexican every single day. And I know what ingredients I am using, and I know how I can put things on my plate. More veggies and fruits, less, protein and whole grains instead of just grains, refined grains, and more water instead of no sodas. Or that's it. And the same with the positive thinking, emotional health, physical activity. So that's something that if you can share, if you want, with others around you. And sometimes it's not easy, but just be consistent, and I think they will see, and one day they will enjoy also, because I enjoy the way I'm eating. I really enjoy. It's not like I'm gonna eat a raw broccoli, which I love, right? But there are a lot of I would say beautiful and great things in the way that we cook. The Indian food is super healthy. The Mexican food could be healthy if you know how to prepare that. Mm-hmm. Even the American food, yes, when I don't eat red meat, but when I want a hamburger, I can just, buy my turkey meat and prepare them, and in a bone that I can prepare also here at home. So there are a lot of possibilities to share a healthier lifestyle with others around you.
That is very good. I agree. There's so many options out there for healthy eating. Somewhere in COVID, after I ate too much ice cream and chips, I said, I've got to stop, because I do have family members that have, my mom has a few conditions, diabetes being one, and her mother had breast cancer. She is also a survivor. And I kept thinking, I have to change the way that I eat things. And for my kids, I don't want this for them. And I didn't expect it to spread to others. I'm saying it out loud, and I'm like, yeah, this is what I'm doing, not thinking that somebody else is like, you know what, Melissa, you're right. Let me start trying to eat a little bit healthier. Yeah. And it can branch out that way. So that is definitely true. and
it's more changes. It's one step at a time. And I think we have a lot of, Melissa, you were saying about the ice cream, and sometimes we as a culturally relevant content that we share, we are talking about tortillas, and I don't know, frijoles, beans, or that we know, and we are teaching them how to choose healthier. So if you like ice cream, I would say, for example, you can put in the freezer, like a banana or a mango, and they just put it on the blender with a little bit of almond milk or something like that. You're going to have an ice cream as well. Maybe it's not the ice cream that we used to go and buy, in the corner of my street, but it's going to be like a different, it's not like you're not going to enjoy an ice cream anymore, but just be wise when you are deciding the ways that you're going to be eating and feeling and thinking. So that's why it's a journey.
Yes, it's definitely a journey. And it's the same for, you said positive thinking. Times I have gotten very negative thinking, and that can spread. And then somewhere, COVID was a huge eye opener for me. And I know a lot of other people, they have that time to just sit and think. And I can't think this way anymore. I have to be more positive. I think only negative is going to come. I got to attract the positive. And just like with the healthy eating, that just started to spread as well. So it's amazing trickle effect that you get to see happen there. And I'm just so happy that we have organizations like yours that are promoting these things and, healthy eating and positive thinking and definitely the exercise. So just not even have to be the gym, just taking a walk or something. You see people doing it and you might want to join in, and it's good to have that community. Sometimes you start that journey and you're on your own, and it's great that you have these different platforms that you can, talk to somebody and you're like, oh, this is what I'm going through. This is how I felt that day. So you're very big inspiration. Thank you for
we're going to keep doing what we are doing. We believe in the mission of Rosa Rojo. We have seen the impact. We have seen how the lives of Susana, Lourdes, Rosa, Maria, they are sharing with us what they are cooking with their kids, what they are just, last Saturday, we had a graduation ceremony with 89 Hispanic women that they finished the Rojo Way. And one of them, she was sharing with us that she was now running, races like 5Ks and never before she was doing that. So that's super cool when you are listening, living testimonies of how they are just changing little by little from less, to a bigger goal. But they are just doing that, and they believe. And they once you are changing, I think we can feel the change. That's the most important. It's something that just give it a try, because you're gonna see how you are sleeping and feeling. Sometimes is like faster for some people rather for others, but just keep trying, and we as Rosa Rojo, we are going to be there for them as well.
Love it. I absolutely love it. So if somebody just completely falls off, what if they take a complete break and they're not checking in with the monthly, you said you guys have monthly Zoom calls, and they're not on any type of social media or anything? Would they have to, say it's been a few months or a year, would they have to rejoin the program to start over, or would they just pick up where they left off?
Well, we have donors, and they used to give scholarships for the participants. So once you have a scholarship for the Rojo Way, it is important to finish the program, because then we will need, and if you don't, we will need another scholarship, in order for you to continue the program. So it is a commitment. So if you want to participate in one of our Camino Rojo, the Rojo Way, you can send an email to info@rosasrojo.com, and then you can just say, I'm interested in the Rojo Way. I would like to see if you have scholarships. So we can give scholarships. You are part of the Rojo Way, because every single person walking the Rojo Way has an investment of $300 if the program is virtual via Zoom, or $370 if the program is in person. So it depends. So once you have a scholarship, and then you finish the program, you have the graduation, the support groups and social media, of course, we are not gonna charge anything. We have another donors in order to make those programs a reality for you. So just follow us on social media. We share the support groups that we have every the last Friday of every month. The podcast is on Spotify, Apple Podcasts, Google Podcasts, Podbean, YouTube, or website. If you don't have any of these platforms, just go to rosasrojo.org, and then you will see the podcast over there. So it's up to you, right? We are here for you. We are building this community, but also it's up to you. It's something that you just need to say, I want to be in. I want just to make changes little by little. And then the information and the resources are here for you.
Great. You are bringing in such a good vibe and the vibrations to your community, and also doing a lot of good work. Melissa, I am the timekeeper this time. Before we end this talk show with Aidee, any final questions or thoughts, any questions that comes?
Thank you so much. I just wanted to say thank you. We are here in North Texas to help. We work through community partners. So also, if you are a community partner, if you are a nonprofit, if you are a community clinic, if you are a church, if you are another nonprofit, working with Hispanic communities, send us an email and we can talk how we can just deliver the Rojo Way and Supervive through you. So that's what we are doing since in effective way since 5 years ago, and we're gonna love to keep doing that. Follow us on social media, Twitter, LinkedIn, Facebook, Instagram, just to see what we are also offering in the community. And thank you so much, Stop Now, for this opportunity. I love how you are encouraging us to stop, listen, and share. And thank you for this opportunity to share with also your community and your audience.
Yes, it's been so wonderful to talk to you. You have such a beautiful spirit and energy. Like, even though I'm on the complete opposite side of the country, but you have a wonderful energy. I love it. So it's been great to talk to you. Thank you so much for coming on today.
Thank you. Thank you. And it's an honor for me to be here sharing with you.
Yeah. Have a wonderful day, Aidee.
You too.
Bye.
Bye-bye.